COVID-19, there's so much that we talk about vaccination, and people are getting vaccinated, putting on masks and observing social distance. But there's so little about how to actually manage COVID-19 if you are positive. So Dr. Jansen, COVID-19 is scary because you could die from it, right? But what is the strategy to not die from COVID-19?
Okay, so you have two benchmarks that we need to manage, okay? So COVID-19 kills through inflammation and comorbidities, okay? So the complications of COVID-19 is because of the inflammation, and you increase your risk of developing these complications because of the comorbidities or the pre-existing illnesses that you have, okay?
So is it true that COVID-19 severe and critical cases are largely or almost all pneumonia? That's how people die from COVID-19.
Yeah.
So the two strategies that you said is lower inflammation, control inflammation, and control your comorbidities. So right now, what I'm going to do to help everyone is ask Dr. Jansen how our standard approaches measure to that. Vitamin C, first one. Does vitamin C meet these two criteria?
No. It just barely achieves the lowering the inflammation. Okay.
Even though vitamin C is an antioxidant?
Yeah. It's because vitamin C is used by a lot of chemical processes inside the body. So it really doesn't. It's sort of like the dose that you take in will be divided to specific processes.
So many processes
inside the body, if not really fight off the complications of COVID-19. Also, there's a limit on how much vitamin C you can absorb. Okay.
So what about zinc and vitamin D?
Zinc and vitamin D is the same. In the same principle, zinc is primarily used by our immune system for a specific biochemical process. Okay, so by taking in zinc, just makes your immune system function well. Not really, kill the virus or or prevent you from getting infected, or prevent you from getting the complications. Okay.
If that's the case, so am I right to say that our common understanding that vitamin C, zinc, vitamin D, all these boost the immune system is it's not a totally accurate description.
No.
So vitamin C, vitamin D, zinc, all this helps or makes sure that your immune system works well, but it does not turbocharge your immune system.
Yeah.
Okay. So in that's the reason why for the treatment and management of COVID-19, vitamin C helps, but we don't rely on it to actually effectively treat the patient.
Yeah.
So then what is the strategy to prevent a patient from becoming a severe patient and developing pneumonia?
Okay, so you manage the comorbidities, you manage the inflammation.
How can you best do that?
Number one, nutrition. Eat a plant-based diet. Okay, so by eating a plant-based diet, you fight off the inflammation, because a plant-based diet, fruits and vegetables, legumes and whole grains, it's innately high in antioxidants. So if you have very high antioxidants, you would be able to manage the inflammation. Okay? Number two, a plant-based diet is the only diet that has been proven to have reversed a lot of the comorbidities that increase
like
your
blood
risk.
cholesterol,
It's
diabetes.
really good for reversing diabetes, good for reversing hypertension, manage heart disease, even some lowering the risk of some cancers, actually reverse some cancers as well. So with a plant-based diet, you already manage the inflammation and the comorbidities. Now, what if it's really difficult for you to eat a plant-based diet, no? Okay, so let's face the reality here. Okay. So what can you do? So you can choose a supplement that is a whole food. Okay, so if it is a whole plant food, no? If it's a whole plant food, then it's innately high in antioxidants already. And its nutrition is sort of like, it's more complete because it's made by nature. Okay, so those are the two criteria.
So that would be like in Philippines, that would be taking like your garlic supplements, your malunggay, and in Singapore it would be garlic. We don't have malunggay. All right, maybe your ginger, like ginger would be turmeric, right?
Yeah.
All these will be the high in antioxidants. So Doc, you're saying that contrary to our initial belief, taking some turmeric and malangai might have more antioxidant action to fight COVID-19 than vitamin C.
Yeah, definitely. Because
wow. Okay, that's
vitamin C is just a part of these foods. These foods contain, I don't know, thousands or probably hundreds of thousands
of variations of antioxidant action nutrients.
And these are arranged by nature in such a way that once we take it in, it really functions well with our body.
Doc, then I'm going to ask a biased question, but you know, turmeric, malangai capsules, SimplyNature PPAR tablets. Where do we stand?
Me personally, I would choose SimplyNature PPAR tablets. SimplyNature PPAR tablets is made by it's made out of microalgae. So microalgae is a superfood. It's one of the most complete food that that is available in nature. Okay, NASA is actually even considering or utilizing microalgae as a food for the astronauts. I'm not saying that the other foods are not nutritious.
They're all good.
Or they're all good. It's best for you to actually eat all of them. All three, right?
But if you had to choose,
if I will choose one, it would be SimplyNature PPAR tablets.
Okay, I just wanted to add that SimplyNature PPAR tablets, not only does it control inflammation, it actually is a gene activator. It contains PPAR agonist, so that actually triggers the anti-inflammatory response of the body. And Dr. Jansen mentioned treating the core morbidities is an important strategy in preventing you from becoming a severe symptom or critical symptom COVID-19 patient. So we actually is proven, we have done clinical trials and it's being used by doctors all over in Philippines to manage blood sugar levels, to manage blood cholesterol. And imagine we use SimplyNature extracts for chemotherapy patients. You can imagine the cytokine storm in a chemotherapy patient. Their inflammation is going through the roof, and yet we are able to almost help chemotherapy patients go through chemotherapy, very little side effects. So imagine the anti-inflammatory response action on a COVID patient. So this is a short clip. We hope that we've given you clarity and given you comfort so that you don't need to be worried and you know how to choose what to take to treat and manage your COVID-19. Now, if you want to hear more details than what we've just covered, we have an entire extended interview with Dr. Jansen where Dr. Jansen actually goes through the drugs that doctors prescribe to COVID-19 patients so that you have a full picture of what will happen. And I guarantee you this, after watching that and learning how doctors treat COVID-19 patients, you will be less afraid. You will be able to be more calm and confident that you will recover if you become COVID positive. So please click on the links below for that full extended interview. So see you again in our next quick bite and see you at the next Simply Heal.